PTSD, or post-traumatic stress disorder, is the current terminology provided to what we describe as a pattern of abnormal behavior or stress response that anyone can manifest, whether they be military or civilian, due to generally a particular circumstance that they continue to relive or revisit, where they're experiencing often physical symptoms based upon whatever had occurred or whatever they had witnessed in the past. The term comes from previous terms, even out of the military, things like shell shock or battle fatigue. Those are all synonymous with what we now call PTSD, because we realize this isn't not exclusive to a combat situation. This can occur from car accident survivors. This can occur from near drownings. This can occur from assaults. And certainly in today's news, there are plenty of things happening around the world where people in an unexpected situation are suddenly pressed into what could be a very violent or a very traumatic experience. And they frequently will carry that burden of that stress with them, and it may be the primary care provider that they first reveal it to, or a family member who then comes to their doctor and says, hey, you know, my family member is really struggling. And it can take some time to pull out some of the details to get an awareness that, yeah, this person's really struggling with something that has created an abnormal pattern of behavior for them. And that's really what we're looking for. I like general terms that people can understand. Everybody understands what stress is. And so I explain, if you're experiencing stress, for whatever that is for you, that sidetracks you or distracts you, or you can't get out of your head, and you find yourself participating or committing certain behaviors or actions that are preventing you from being functional, right? Getting up on time, getting to work, getting to school, talking to your family members, feeding yourself, getting dressed for the day, what we call the activities of daily living. When those things fall off and people notice them, that's what we see as a pattern of stress behavior. If we can link it back to a behavior, we might be able to say, well, sure, that's a traumatic event. This has occurred after. That's a post-traumatic. They're now stressed. This is a disorder because it's ongoing. So that's where the term originates from. But the reality of it is we're looking for patterns of stress and abnormal behavior that are sidetracking people from enjoying their life. We want to help step in because we can identify it. And now there's a lot we can do with greater awareness to help them. A lot of times what they need is to just understand the fact that what they're experiencing, one, is normal to the event. They're not a weird person. They're not having some abnormal reaction. They're not the only one who's ever experienced this type of response after some type of event. So if we can help them understand that what they're experiencing is normal or expected, or at least something other people can perceive, then a lot of times we can help them understand that there may then be a next step towards healing, resolution, or at least coming to grips or terms or being able to control what may be the behavior or the stress, so that they can begin moving forward with their life. It's almost like mourning the loss of a loved one. Many people get stuck in that day, and we try and remind them, look, you may be living moment to moment right now. As that stress backs off, as you're able to manage and work through some of these issues, I want you to start thinking from moment to moment, to day, and then from day to week, and then get your head up and start looking over the horizon, and let's start making plans for whatever it is that you like to do for the future, because right now you look like you're stuck and you look like you're in a bad place, and we know if we don't help them, there's a higher incidence of things like suicide, other maladaptive behaviors where they may become abusive towards people around them. Really, it can be a very unsafe situation. So there's definitely a need to help, and amongst a lot of primary care doctors, even though we get busy, it's that long relationship we have that a lot of times pings our radar. Something's not quite right, and you just have to kind of take your hand off the door handle, sit back down and say, tell me what's going on. And if you can just get one of those, it a lot of times is very worth it to have had that intervention where you can see somebody open up and begin to realize there's help out there. And it may not even be from the doctor. You know, it may be just the fact that we identify it, and now we can move them in the right direction to whether it's a support group or a specialist counselor, or even a family member, clergy, anybody who can help kind of support them and recognize that they're hurting and they're in need, because so many times there aren't a lot of outward signs for what they're dealing with.